Everyone. This is the first installment of a new series that we're doing. It's called Success with Stacy, and I don't want to take credit. I did not come up with that. Miss Andrea Rosemeyer on 500 and 100 came up with that. She's always got the creative mind. So we're going to talk a little bit about something different each week as it relates to patient satisfaction. I hope to give you a few tips. I hope to get feedback from you all as well on what you would like to see, things that you're currently doing. Maybe you could share with me that are working well, and any challenges you might have as well. We're going to start off with talking about courtesy and respect. Now, overall, as a hospital, we do really, really well with courtesy and respect. It's one of our higher nursing domains. In fact, it probably is the highest question on the nursing domain. Our most recent top box score in courtesy and respect was 89.42%, meaning 89.42% over this first quarter of 2020 of patients rated our nurses as always giving them courtesy and respect. That's actually down about 1.9% over the fourth quarter in 2019. So it dipped just a little bit. So what we're going to do is just talk about a few tips, things that you can do, what courtesy and respect will look like to the patient. And as you know, it's a little bit different for every patient. We're going to talk about that some too. So one thing that you can do is just watch your body language. Make sure you're looking at that patient in the eye. Smile when you can. If you have a chance to sit with the patient, that's perceived as being respectful and courteous. Also, use keywords like, for example, if you're going to be doing maybe inputting a catheter on a patient, go ahead and say, I'm going to close this curtain for your privacy. That shows that the patient that we're being respectful of their privacy. If the patient's talking to you about something, try not to interrupt if you can help it. That is one of the main things that I struggle with, to be honest with you. And I have to just kind of give myself a little pause and let that patient finish. Watch if you're the type that tends to interrupt. Kind of keep a watch out for that. Address the patient respectfully. And what does that mean? Well, when I was a kid, my dad always wanted me to call him sir. And I just never really felt comfortable. I just thought that was too formal for me and my dad. But he is of that generation where that's just respectful to call someone sir or ma'am. So sir or ma'am is fine. The patient's first name or Mr. and Mrs. Smith is fine. Just try to stay away from those terms of endearment, such as honey and sweetie and sugar. A lot of patients don't like to be called by those types of names, especially our little bit older generation. If you can think of the patient and their cognitive ability. I know sometimes some of us have a tendency to treat patients or talk to them in like a childlike voice, and some patients find that disrespectful. So kind of watch that, what kind of tone you're using with that patient. Definitely involve the family when appropriate. The family is our patient's support people. So it's respectful to get their input about that patient as well. Probably one of the most important things you can do with your patients is to just establish a connection. See what's important to them, see what they like, get to know them a little bit better, and just your interest in them they will perceive as being courteous. If the patient's telling you something, use what we call reflective listening, meaning if they're telling you about when their chest pain is, you might say something like, okay, so what I hear you say is your chest pain is mostly in the mornings or whatever. That way they'll know that you're listening to them, and they will perceive that as being courtesy and respectful. One last tip, don't let the patient know if you're really busy. They don't want to feel like a bother. I think a lot of them already do feel like a bother. I get a lot of, I don't want to bother them, they're really busy. I get a lot of that from patients, and we never want them to feel that way. It's very respectful for us to let our patients know that they are number one in our care, and we want to take care of them to the best of our abilities. So if you're worried about a tornado watch or some other patient did something to really upset you, please don't let the patient know any of that. We want to be professional as much as we can. Appreciate everything you guys do. You're doing a great job. I just continue to hear wonderful things from patients, and I'm so proud of each and every one of you for what you do for our patients. Reach out to me if you have feedback, suggestions, anything at all. I'm available for you at all times, and I will see you next week. Thanks.